Hi, everyone, and welcome to our special National Infertility Awareness Week series. Today's episode is a powerful conversation about family, resilience, and advocacy. Scott and Erin, who previously shared their journey to parenthood through egg donation, have returned. Their commitment to the infertility community didn't end when their family was complete. Scott and Erin have continued to use their voices to raise awareness, support others, and push for real change. In this conversation, we dive into the often isolating experience of infertility, the power of sharing personal stories, and the urgent need for better healthcare coverage and support systems. We also explore how advocacy, both personal and legislative, can make a lasting impact and why initiatives like National Infertility Awareness Week are so important. Whether you're personally impacted by infertility or simply want to be a source of support, we are all in fertility. And this conversation is full of insight, hope, and actionable ways to be a part of the change. Enjoy. Me, you, and who? Who knew it would take more than two people to have a baby? In a world where infertility is no longer a taboo topic, this podcast will take you through all of the different aspects of surrogacy and egg donation through the lens of many who walk this journey in different ways. My name is Whitney Hall, and I am a two-time surrogate, now turned surrogacy coordinator for Egg Donor and Surrogate Solutions, the very agency I used when I chose to carry for two amazing families. With this podcast, it is our goal to help guide and support you as you learn about what it takes to grow a family in an alternative way, as well as hear inspiring and beautiful stories of how this path has changed lives forever. We can't wait for you to hear about just one more way happy families are created every day. Well, like I said, you guys, thank you so much for being here again. We are just so lucky that I feel so lucky that I get to talk to you guys again. You know, you both have previously been on just to discuss, what it was to your path to parenthood via egg donation and all of that. But now we're going to talk a little bit more. You guys made your family, and instead of being like, all right, good. We've done it. Moving on to the next, you guys have decided to, continue to just invest in this community through advocacy and everything. So just tell us more about that. Give us more, like, kind of what started you guys just wanting to kind of have, I guess, that passion and, make just greater awareness when it comes to, just the infertility world.
Yeah, I think for me, like it can be very isolating because it tends to be not something that a lot of people talk about.
Yeah.
And then once I did start talking to a few people about it, then they would tell me their stories as well. And it was kind of interesting. Like the more that we got out there and like started talking to people, the more we realized this impacts so many people in so many different ways. My personal history comes from, infertility from cancer treatment that I had when I was younger. And so from that perspective, I've kind of always been, able to, I think, sometimes be a little bit more open about it just because it was this kind of big medical thing that happened to me in the past.
Sure.
So it's always kind of been a part of my like language and story throughout the years.
Yeah.
But as I got into more of the fertility side of it, and just talking with coworkers, talking with girlfriends, I know you talking with some of your guy friends at the gym. All of a sudden, it's like, wow, a lot of people go through this in so many different ways, and I think now hopefully it's changing a little bit where people are talking about it more. And so that's where, that kind of sparked the interest of, hey, like we have a story to tell here. And if we tell our story, other people may feel more comfortable to tell their story. And just getting it out there more so it normalizes it more, that this is something that affects so many people on so many different levels. And so it just, honestly, it just kind of started from that, really.
I think it's important as well for us, if there's something that we struggled through, to try to make it so other people in the future struggle a little bit less.
I love that. Yeah. Just that whole idea of paying it forward and making it, like you said, a little bit easier for the next person. Because you're right, Erin. I mean, I feel like it is such a common storyline of I felt so alone, and yet this affects infertility affects so many people in so many ways, right? Like your story of cancer treatment to, just unexplained infertility. I mean, across the board, it affects so many people. And yet, like you said, everyone feels so isolated.
Mm-hmm.
Yeah. And I mean, like, and again, just exactly that, to share your story, that alone is just so impactful.
Mm-hmm.
But you guys have gone beyond that. Tell us a little bit more.
Yes. So we were, I think, a bit frustrated going through it at the time.
Sure.
That there wasn't a lot of help. Like there wasn't a lot of assistance. We didn't really have help from the jobs that we were working in at the time for any financial medical coverage. Like that wasn't in the policy at all. And it just kind of started a bit, kind of getting a little bit into the weeds on that. Like I remember emails to like human resources and why is it this way? And just trying to understand and kind of unpack kind of the history of it all and why it, isn't covered the way that it should be, why it's not just, something standard that's packaged into medical plans. And as we kind of got into that a little bit, then the fertility doctor that we worked with, she was actually a part of an advocacy group here and kind of pulled us in as just a patient that could tell their experience to this group of stakeholders. And so that was really kind of the start of it a little bit was to, just kind of, share, kind of our journey and how some of the coverage impacted us, impacted the decisions that we made, impacted what we were able to kind of do. And then you get a little bit more connected and a little bit more connected. And it just kind of grows. And so I think that's what's really cool about advocacy is just, even if you get out there just a little bit, you're going to make these little connections over time that, as you choose, you can kind of grow it and jump into different things. And so that's really allowed me and Scott, kind of through the years to, people know that we want to share our story. They'll reach out to us when there are, opportunities. And that's just kind of how it's grown bit by bit.
Yeah, I think it's important to think about what advocacy looks like, and it's not just putting on a suit and going to Austin to talk in front of the legislature. It's talking to your group of friends, like Erin said, at the gym, and hey, we I remember after some of the difficulties she had through childbirth, talking to some of the guys there, and we realized how many if we were back 50 years ago or in any other place in the world, how many of our spouses would have been lost, how many of our children might not have made it, and just having those conversations where you all of a sudden wow, that's advocacy, that's
that's community.
There's a lot of different ways to be an advocate for this. Some of the maybe more uncomfortable ways for certain people, like getting up in public speaking and things like that.
Sure. Well, I love that, Scott, because you're right. There is such a range of it's that spectrum, right? That it is, yes, we need absolutely all of those people on Capitol Hill, and that is, that makes a difference. And it's so important. And to your point, there is that need of Capitol Hill, and it does make such a difference, and it does make the next person have a bit of an easier go. And also exactly that, Scott, of we're at the gym and just knowing that someone else has had that experience, or I'm going through it, with them together, is again breaks down that barrier of I'm not alone. I do have, other people that are part of this, and then we can have those conversations, and then that can just it creates this beautiful ripple effect.
Yes.
Absolutely. Going back to just a little bit, and just to break it down, when you were talking about healthcare plans, you're specifically talking, Erin, about insurance and and your HR policies and things like that. What were some of the barriers that you were firsthand experiencing, and when you did, and then eventually when you did speak to that advocacy group, what exactly were you kind of trying to make people aware of specifically?
Yeah. So in the beginning, it was just trying to unpack, quite honestly, what wasn't covered basically, which ended up being pretty much almost all of it. And so then, just trying to understand like finances and how much is this piece going to cost and this piece going to cost and this piece going to cost. I mean, it probably honestly took us like a couple of years to even just get ready to like do all of these different steps financially and just kind of for all of that. But along the way, I learned about some resources from different nonprofit groups. There were some grants that we were able to apply for, and we just kind of had the mentality that any little bit, helped.
Absolutely.
And because it is a really big financial undertaking, and we had thought, oh well, we probably won't qualify, for a lot of this stuff. And actually, when we dove into it, we did, and I think there were 2 different grants that we applied for and received, which we were very grateful for. And so so then I think that's another piece of the advocacy is reaching out to let people know resources that are available. So for example, where I work now, we have a group of us that champion different resources for young adults going through their cancer care. And it's supposed to be kind of like a one-stop shop where they come and they can have this comprehensive needs assessment. And a part of that is fertility preservation, or, down the line, you're ready to start your family. How do we, get you connected to those people? And so that's been really great because then we can take this group and we meet once a quarter. And we talk a lot about fertility. How do you talk to your patient about fertility? And so now, my work in advocacy in that group has now kind of spilled down to this whole other group of providers. And they're now advocates in their department because they feel empowered to have these conversations and kind of train some people in their group with how to have those conversations. So I think the more we can just connect people to the resources that are available through advocacy as well, that's huge. Because it's already such a big process to understand just medically in and of itself. And then you add in all of these other layers to it, and it can just be a lot.
When we started going down the path for, to build our family, I was working for a larger European company. And I was disappointed to look through our coverages and realize that there was nothing in there for, family planning, family building. And so I started talking to our HR department about it, and I did a little bit of research on it, and found from the World Health Organization that 1 in 6 families in the world will suffer from some type of infertility problems, and talked to them about I detailed out like the ages of people working in the company and what actually relatively small impact that would have financially on the company to provide benefits like that, but what a huge impact that could make not only to their employees, but as a employee recruitment and retention tool. And unfortunately, it didn't work out for us, but shortly after we got through the entire process, they did end up adopting fertility coverage as part of the benefits package. And so hopefully that will help some of my coworkers down the road. It really only takes a conversation and sometimes maybe a persuasive argument, but if you have the conversation, people are inclined to listen.
Yeah, no, for sure. So speaking of that conversation, how do you approach, I mean, you obviously did this full extensive research and, I'm envisioning a presentation and pie charts and, just
it was
all
a lengthy email.
I love it. But how do you, maybe for people who are needing to take those steps to approach HR or their boss or, just really just in general, I mean, how would you maybe, or how did you, I guess, approach conversations, for people who don't necessarily fully understand what it means to be a part of the infertility community and how certain benefits really can make a huge difference.
Well, I think there's nothing more powerful than your own story.
Yeah.
And, you know, when it's an idea, people have trouble connecting with it. When it's your story, people can connect with it much easier. And so, that was always my path was, hey, this is something we're going through. This is something that not only we are going through, but something I can guarantee you, flat out guarantee you, that a number of people are also going through.
Yeah.
And I'm willing to talk about it because it's something that needs to be said. But there are a lot of people that don't feel as comfortable doing that. But they're going through it too. And I think not only in the workplace, but even I think in our families, we've seen a change in some of their thoughts and opinions as they've gotten to put a face and a face with a story and a face with a concept.
Yeah. When you say thoughts and opinions, what do you mean by that? Are you thinking like, is it misconceptions? Is it like, tell me a little bit more what you mean by that.
The thoughts and opinions of like our family and how they're changed. Is that
either the workplace, right? Like maybe it is kind of, this really is just so, this only affects a small amount of people, like, or, maybe this is too expensive or, kind of what were some of those things?
I think for a lot of reasons, anything around fertility and family planning, it has a tendency to be a bit of a live wire sometimes for people.
Sure.
And so I think that sometimes there's these ideas of extremes out there, and to be able to talk about it in our experience, it's not actually usually that world of extremes.
Sure. It is not the People magazine. It is not the headline.
Right.
Yeah.
And our case was something very much expected with your cancer diagnosis and treatment. This was always a path that we were going to go down, but a lot of people it's not. It's a big surprise. And again, for us, the pathway there was a very complex process of egg donation and IVF, etc. But again, for a lot of people, their journey to fertility doesn't have to take such a drastic path.
Sure.
So these extremes of opinion, I think don't really do anybody any help. But to be able for our family to recognize that this is a path that a lot of people end up having to take was helpful.
Yeah. You, Scott, specifically, you kind of had those moments at the gyms, but then you did make reference to going to Capitol Hill and, speaking to lawmakers and policymakers. What was that experience like? Why is that so important?
So I believe there are only 19 states in the U.S. that require some form of infertility insurance coverage. It's very helpful to speak to your employer to try to make change on a one-on-one basis.
Sure.
It's even more effective when your employer is mandated to do it. And so that advocacy, that is typically only going to come from one place, and actually in the U.S. 50 places. And so getting out there, reaching out, and making sure that the people who have the power to make those decisions also have an understanding of what they're being asked to make a decision on. Again, kind of back to the idea of these extremes, nobody's asking them to make a decision on that. They're asking for the ability to make our decisions ourselves. And to be able to be in a financial place to make that decision, even if something is legal, if you don't have the financial means to do that, you're not in a position to make that decision. And so advocating for that coverage, for that chance to make that decision is I think, a really important thing to do.
Right. I mean, and it feels so basic. And I mean, again, to your point, right? Like there is those spectrums of people. There's a situation of, where Erin, you knew that this was going to, be the path to, parenthood. You have same-sex couples where it is guaranteed you are going to have some sort of fertility treatment if you want to grow your family in this way. And then, yes, there is the people who, surprise, this was not part of your plan. And now all of a sudden, this is a path to build your family. And exactly to your point, Scott, I love the way you said it. Just the ability to make that decision and not have things like, is, this lab test covered or not covered? And, the difference between a $5,000 ultrasound versus, a $20 copay is huge.
Mm-hmm. Exactly. Yeah. And there's so many different ways that it's impossible to like legislate all of these nitty gritty little details. You know what I mean? And I think some things just get stuck and stalled out in all of that, and it's like, if the medical professionals and the patients could just have the power back to make decisions for what's right for them and their family and what they're trying to do. I think most of that at the end of the day is, when you actually look at it, it's all very reasonable. And we just, having these conversations hopefully brings people back to that conversation of reasonability.
Sure. Yeah, no, absolutely. If in a dream world, what, just at the most basic level, what do you wish all employers had in, kind of their, I guess, their healthcare package, if you will? Like what do you wish everybody just had the ability to have?
Yes. So I think for women, especially as we are trying to advance our careers, sometimes, family planning lags behind that a little bit. And so being able to store and freeze, eggs and embryos, I think ahead of time, that should just be standard, especially if you're the employer who's, asking somebody to do these things in their career. And so maybe they're delaying their own family building a little bit longer. I think tying that, together is huge for kind of women and gives them the peace of mind. And then, full paid maternity and paternity leave would be amazing.
Oh, that'd be amazing.
Across the board. And then, taking it a step further with fertility, it's great to be able to store eggs and embryos, but what if you can't? What if you did that and it didn't work? And then you need more help with IVF or egg donation or surrogacy. I mean, I think across the board, I think everybody should be allowed the same opportunity to try to build their family. And I wish that employers would support that in its entirety.
It's also, I think it's an opportunity to put it back to the employer of, you want to be an employer of choice. You want the best people in your industry to want to come to work for you. And I think for them to recognize that 1 in 6 of their employees is likely to be impacted by this, that's a huge opportunity for them to reach out not only to current but future potential employees and show that they recognize that they want to support the whole employee and be a employer of choice.
Yeah. No, yes, that's beautiful. Again, yes, employers, hear this at the most basic level, exactly to what Scott said. You want to be good to your employees, and I say little, small line items that have such a big impact like this. That's one of the biggest ways you can do it. Absolutely. 100%. For anyone who is maybe, we talk about these things, they seem so big is my one little story gonna really make a difference? Or, oh my gosh, there's no way I can imagine, sitting in front of people on Capitol Hill and, just all of those things. What would you maybe say to someone who they want to get involved, they want to advocate, not just for themselves, but for, just anyone else that's part of, the infertility community? What do you think is maybe one of the simplest way that they could get started?
So I think, like from a patient perspective, if you're kind of through your journey and now you want to try to help others and pay it forward, sometimes even just reaching out to your medical provider and saying, hey, if you have new patients that are going, through a tough time, or you have somebody that wants to talk to somebody who's already been through it, that can actually be really helpful. And a lot of times the medical providers can help to connect people together just on a one-to-one basis. And so that I think can be just like a really easy way, even over the phone or over text message, just to kind of help somebody that's a little newer to kind of walking those steps. And then, from there, if you want to do a little bit more, you can kind of start to branch out into your community. Again, your medical providers may know a little bit of some good advocacy groups, or social work in their medical office may be able to help a little bit with, oh, this is somebody that we've worked with this situation or that situation. There's a lot of stuff online now too. You can kind of join different groups, different chats. Sometimes just being in the mix a little bit and seeing how other people are sharing their advocacy roles. Sometimes like, oh wow, yeah, I could maybe do this or do that. So I think just if you start slowly, then all of a sudden some of the puzzle pieces will kind of start to fall into place.
From the legislative side, obviously there's, organizations like the Alliance for Fertility Preservation, who you can reach out to and say, hey, I would like to get more involved. How can I do that? You can also reach out to a sympathetic legislator. So if you've heard a particular legislator or politician in the past being supportive of this, reach out to them and say, hey, this is something that's important to me. How can I help you push this idea across the finish line? How can we get it onto the desks of some of your colleagues? And how can I be an asset to help you do that as somebody who might have that firsthand, that first person voice?
That's great. Yeah. Again, just sharing your story in, that one more big way. No, that's super great. Thank you. Yes. So almost last question. For things like, National Infertility Awareness Week, why do you think a movement just like that 1 week but why do you think it is so important for families who've been through infertility?
Yeah. I think it makes you feel a part of this collective whole, as a group. Like there's this whole week that's dedicated to, to moving the needle forward on it. And just, I think all of the just kind of love and positivity that's shared, during that week is great. It's always just great to kind of organize it and just say, hey, just for this week, we're focusing on these amazing stories, this amazing advocacy, the changes that are coming down, just helping to spotlight, kind of everything all at once in a comprehensive way, I think is so important.
Yeah, for sure. For sure. And I think it's so fun to, yes, there's a long way to go, but it's also great to kind of look back and see how far you've come to.
Yes,
and
exactly.
Yeah, for sure. For sure. Oh, I love that. Well, you guys, my final question, and you guys have been here before, so you know what I'm going to ask. But as everyone knows, Whitney and coffee are just two peas in a pod. And so I always love to ask the question, what filled your cup today? Literally or figuratively, what has been the thing that has filled your cup?
So we just finished up the Houston rodeo.
Yes, we did.
And our son is 6 years old. And
did he do what I think he did?
He did. He did mutton busting.
Yes.
And, we were like, "Hey, buddy, do you want to do it?" And he's like, "Yeah, I think I will." I said, "Okay." And so we got him down there, and he got his little helmet and his little vest on there.
Oh my gosh. And so for the listeners who are not aware of Houston Rodeo, first of all, it's the most amazing week ever, or 2 weeks. And there's a mutton busting is literally exactly what it is. It's lambs, sheep, and kids riding on top of it. That's
it's simple as you take a 5 or 6 year old, put them on the back of a sheep, and
go.
I told Nolan, I said, hey, just grab onto that sheep and don't let go till they pull you off.
Hang on tight.
He's like, okay, I got it. Yes. And so he gets out there and they put him on a sheep called the Sheepinator. And it's great because they asked him these questions before. And what do you want to be when you grow up? He said, I want to be in the Army Corps of Engineers and I want to be a football player.
Excellent.
So he gets on the sheep and they open the gate and that sheep takes off running across there, and you see him on the video. He's just got it down here, holding on, and he ran clear across there, and they had to pull him off of the thing.
I love it.
So he ended up winning the whole thing, and he got this
the belt buckle
champion belt buckle.
Yes.
So then we had to go buy him a belt,
right.
And he wore that thing around so proudly. It was fantastic.
Yeah.
Oh, I love that. Was he in the arena or was it like the carnival part?
Smaller side.
Yeah. Oh. I love that. Oh, from one Houstonian to another. That just warms my heart.
That was pretty special.
Yes. What about you, Erin? What has filled your cup?
Oh my gosh. Recently, I think I'm very excited to go skiing actually in just at the end of the week with my family. We haven't seen them in a little bit. So it's going to be just everybody all in one big house for the whole week. And so I'm just, for me, that's what tends to fill my cup up when we see my family and Scott's family. We're just so lucky to have such great people in our lives. So I'm very much looking forward to seeing my family here pretty soon.
Oh, I love that. I love that so much. Well, again, you guys, thank you so much for, being repeat guests and talking more just about this, and really just thank you for everything that you have done, are doing, and continue to do for just spreading the word about, what it means to be part of that infertility community. So thank you guys so much.
Absolutely.
Thank you for having us.
Thank you so much for joining us on this episode of Me, You, and Who. We appreciate your time and hope you enjoyed our discussion today. As we wrap, we would like to remind you of some of the ways that you can stay connected with us and be part of the Me, You, and Who podcast community. Firstly, if you haven't already, make sure to subscribe to our podcast on your favorite platform. Hit that subscribe button so you never miss an episode and can stay up to date with our latest content. But that's not all. We also have an exciting YouTube channel where we share some bonus content, behind the scenes glimpses, and video versions of our episodes. Head over to YouTube and hit that subscribe button there as well. And don't forget to click the notification bell so you'll be the first to know when the new episodes go live. And for more exclusive updates, engaging discussions, and a chance to connect with fellow listeners. Be sure to follow us on our social media accounts. You can find us on Instagram, Facebook, and TikTok at Create a Happy Family. If you're interested in finding out more about creating a happy family, please visit us at www.createahappyfamily.com. Thank you again for being part of the Me, You, and Who community. Your support means the world to us. I can't wait for you to join us next time as we continue to share stories and journeys of creating happy families.